Dr. Ben Pearl with Fifth Foot U. Today I have Gary Ho, who's a doctor that specializes in orthobiologics and ultrasound, and he is here at the Academy meeting for podiatric sports medicine in Washington, D.C. And give us a couple highlights. You talked about some regulatory stuff with the FDA, some stuff that's coming into favor and out of favor. In a synopsis format, what are some of the things that people should know about using orthobiologics?
That's great, thanks, man. It's been great to be here. So we talked about some orthobiologics. We gave some examples ranging from some more of the traditional prolotherapy approaches to some of the more recent findings and techniques for platelet-rich plasma, bone marrow aspirate concentrate, and lipoaspirate. So we spoke about that, and some of the highlights here is that the FDA and FTC have a pretty strict regulatory environment in which we practice in the country. So we want to kind of make sure that we keep mindful of what those rules are to keep us in compliance. And also, as we talk to our patients about these therapies, it's very exciting and a lot of potential, but there's a lot of promises out there, some of which are probably more or less well founded in the literature. So we want to be nice and transparent with our patients and open to learning new things.
And you mentioned that although platelet-rich plasma has not run into any problems, with things like placenta and amnion, you have to be particular and examine which company to make sure that they're following the appropriate regulatory guidelines for that. And I think you had mentioned exosomes, although potentially showing maybe some promise, those have kind of had a kibosh.
Yes, I think that some of the off-the-shelf orthobiologic products have really come under a lot of scrutiny from the regulatory bodies, and that includes placental-derived therapies as well as exosomes. So, as we start to use them, unfortunately, there's a lot of potential there, but they've really become riskier to use when being looked at by the FDA. So looking at autologous products are a little safer from a regulatory standpoint, but certainly this is an ongoing topic, and I hope that as time goes on, these federal agencies will welcome more conversation and discussion about what's helpful, and hopefully the environment can get more permissive.
And in your clinic, you're able to potentiate some of the products like PRP, for example. You have some things that can upstroke the efficacy.
Yes.
Give us a couple examples in an older patient that might be pre-diabetic. So I'm pre-diabetic myself, and so at 58, hard to believe. But so what would be something that you could do to help potentiate to get a better outcome?
Sure. I think more recently what we've learned is that dosage matters when it comes to platelets. Not only does dosage matter, that matters even independent of any other host comorbidities or other kind of challenges. But in somebody who's, say, older or with compromised metabolic health, I think that it's helpful to realize that perhaps their platelets may not function as optimally. So we can compensate for that, either by adjusting the dosage of platelets that we use in something like platelet-rich plasma, and also perhaps help with modulating the activation of those platelets. So, for example, if you were to draw a certain volume of whole blood to make a certain PRP product to be able to use, you might consider making the same volume of PRP, but from a larger blood draw in order to have a higher platelet dose. That would be one way to compensate for that compromised platelet function. The other would be to use an activator. Two most common activators that are used is calcium chloride and recombinant thrombin. I think calcium chloride is probably the one that you see a lot more people using. It's relatively inexpensive. It can be used to kind of help push the platelets to activate, degranulate their granules more completely than somebody with compromised metabolic health.
As the piano cues us to wrap up, what about the ultrasound finding the pathology and how that's helped you and some of the newest techniques that you touched on?
Absolutely.
Give us a couple highlights.
Happy to. I think, we talk about these therapies and they're very exciting, but none of them are as effective as they could be if we don't accurately make a first accurate diagnosis and or accurately place whatever therapy that we're looking to apply to a tissue environment. So ultrasound can be very helpful, and I think one of the take-home points from my talk today on the ultrasound cases is to think of ultrasound as an extension of a physical exam, and to use that to kind of scrutinize, how the patient feels, not just what they look like.
Mm-hmm. And was there a nerve type technique that you found that you can isolate the nerves better? Hydro?
Oh, the hydrodissection,
Yeah.
yes. So, traditionally we look at nerve entrapments, and entrapment's a large spectrum of disease that can affect nerves. And in some of the entrapments you have adhesions around the nerve, and one way to address that would be to use a technique called hydrodissection, which is a shorthand for a much longer title for the procedure, which I'll summarize as an esthesiolysis neuroplasty hydrodissection. And what we're trying to do there is inject fluid around the nerve to separate the nerve from its surrounding soft tissue tethers in order to free the nerve, and by that method disentrapping or unentrapping the nerve.
Well, thank you so much for doing this. I learned a lot at your lecture and look forward to you doing future stuff integrating with your academy. It's great to sort of cross discipline. Thank you so much, Jerry.
My pleasure, man.
All right, thanks.